Hi guys, welcome to the FAQ sections in the bone lesions. Okay, so I hope you all have seen all the videos in the bone lesions. We starting from the what your developmental defects of your bone, that is our osteogenesis imperfecta. Then we discussed the benign tumors, the malignant tumors, the fibroosseous lesions. Okay, so we have discussed most of all the bone tumors, and let's do some questions. Let's work out. I hope you have finished seeing the video. Now here the question is: an 8-year-old child presented with bilateral lesions of the jawbone. Okay, 8-year-old child and bilateral lesions of the jawbone. Histological picture is shown below. Okay, we have an histological picture. What is there in the histological picture? Can you appreciate anything in this histological picture? Can you appreciate anything with your experience? Anything in this picture? We can see some kind of cells with more nucleus. Okay, I can see some kind of cells with the more amount of nucleus. So these cells are giant cells. These cells are nothing but giant cells. A giant cell, what do you mean by giant cell? A cell with a multiple number of nucleus, that is giant cell, right? So I am seeing a lesion with a giant cell. And bone blood examination, serum calcium is 14. So there is increased serum calcium. That serum calcium is normal value is 9 to 10 milligram per deciliter. Here I have hypercalcemia. Okay, so the child is having hypercalcemia. Parath hormone level is 95 and parath hormone levels is slightly increased. The PTH level is increased. Now with this we can say the what is the person suffering from. So you have seen cherubism fibrodysplasia. In cherubism fibrodysplasia, all your serum calciums are all normal. Serum calcium, that's why we told serum calcium, serum phosphorus, serum alkaline phosphatase, these are all normal in your cherubism and fibrodysplasia and your ABC itself. So from the single point itself you can find the answer, right? Okay, so it is nothing but your hyperparathyroidism. The parathyroid hormone is increased. This is increased parathyroid hormone, we call hyperparathyroidism. The hyperparathyroidism is nothing but your Brown's tumor. Brown's tumor is what your hyperparathyroidism is. Okay, it is called Brown's tumor because it's the brown in color because of the hemosiderin pigments in the tumor. Okay, doesn't matter. See, by diagnosis by exclusion, what we say is that come to the answer by excluding the wrong answers. So when the calcium levels are increased, you know that the hypercalcemia is there. So you can exclude cherubism and fibrodysplasia because you know that in those cases serum calcium, serum phosphorus are normal. Okay, so this is one thing. Yes, which among the following? Yeah, this was the INI-CET paper. Yeah, this was INI-CET paper. Among the following features regarding cemento-osseous dysplasia, all are true except. Okay, so associated with other odontogenic lesions, associated with unerupted tooth, a vital tooth, and option is common in white males. Okay, so I hope now you know the significance of why I insist that most common location, age, and the gender predilection. Okay, striking gender predilection. Okay, those things you should know, which is most common in males, most common in females. Okay, where all the lesions it is not necessary, but those lesions which have a striking predilection, okay, that you should be knowing. So from these options, even if you don't know the other three options, one thing you know, it is a vital tooth is there. Okay, that is there. Okay, so this vital tooth is a true statement, so they are asking except. So this is a true statement. Vital tooth is a true statement, so we avoid that. Associated with other unerupted tooth, we don't know, and associated with odontogenic lesion also, you don't know. Okay, it doesn't matter. Now, common in white males. They are saying that this is common in white males. We know that this is 90% cases, this is seen in females. So, which is not true here? The answer is A. Okay, it is in white males. Now, what is this? Bulbous root abscess seen in IOPA. You can see this. So while we were discussing about the lesions, while discussing about certain lesions, cementoblastoma, I think we have discussed cementoblastoma in odontogenic tumors. I don't know if you remember or not, but if you are not remembering, please go back to the video of odontogenic tumors and see cementoblastoma. Revision, revise, revision is the key. Okay, so there we have, I have shown you a radiographic picture, okay, of how to identify things. Okay, can you see this radiograph? You can see this radiograph. You are seeing bulbous roots, radio opacity around this bulbous root, but you can see the root apex. You can see the root apex. You can see the root canal. Okay, you can appreciate the root canal. You can see the root apex. Okay, and this condition, again, I think I will go to the odontogenic tumors and show you the lesion there. So if I have, I will show you. Mm, yeah, yes. See, okay, I have shown you this radiographic picture. I think that comparator picture. Now you see this. You can see this. The second one here. Okay, can you see the radiograph here? Can you see that radiograph here where you have that radio root canal and the apex very much visible, right? So this is the comparator, and what is the answer? It is hypercementosis. The same thing is what they have asked here. Okay, can you see this? The same thing they have asked in the exam. So such simple it is. When you know the concept, it is that simple. Okay, so here it is. The answer is hypercementosis. Okay, so that is one thing. Yes, most common. This is INICET paper, 2021, yeah, 2022. Okay, most common location of juvenile summomatid ossifying fibroma. The most common location for juvenile summomatid ossifying fibroma is your sinus as well as your orbits. Okay, summomatid juvenile. Where trabecular juvenile, it is mostly your jaw. Okay, so from the option, the answer is orbit. Okay, so I hope you now know how to approach the questions and how the questions are asked. Okay, see you in the next video with a new topic. Bye.